All right, Dr. Dana Mansour Reid, thank you so much for coming out and talking at GOMA's pediatric seminar today. You talked about anxiety in kids, really, basically, adolescents. Tell everybody a little bit about your practice, if you don't mind.
Okay, well, first of all, thank you very, very much for having me. It was a pleasure and honor to be here and to help talk and allow this to be applicable. I'm actually a child and adolescent psychiatrist in private practice in Alpharetta, and I see children's, teens, and also adults to help with managing different psychiatric conditions, including anxiety, depression, combination of therapy, and medications if needed.
Wow, that's great, super. I'm sure the community is happy to have you there. You talked about SSRI use as part of a treatment for anxiety. Maybe, and of course there's a little bit of hesitation about that. Maybe you can talk about its benefits and then a little bit about some of the black box warnings that we've had over the past 15 years or so.
Okay. Well, first of all, like you said, it's part of a treatment plan. When I look at addressing anxiety and depression, I always make sure looking at a comprehensive plan in terms of making sure also talking about exercise, nutrition, diet, and healthy coping skills. In some incidents, medications can be very, very effective, and SSRIs are usually first line to help teens and kids with anxiety. It can be very, very beneficial in terms of helping bring down the anxiety and helping kids do really, really well in functioning. In terms of the black box warnings, there can be some concerns people may have that it can increase thoughts of suicide or worsening depression. However, that is very low, and we usually tend to monitor really, really closely to make sure that that is not happening. If that were to happen, the kid would stop the medication, but we always want to make sure that it can be very, very effective in recognizing that.
And so from what you told us about the studies, it's 2% increase in suicidal thoughts, not necessarily attempts, and that when they had a decrease in SSRI use, there was an increase in suicidal thoughts. Is that a fair statement? Is that a fair summary of it?
Yes. So I feel like there was a concern in 2004 when the FDA came out with the black box warning that it can increase suicidal thoughts.
Right.
At that time, the increase was very small, 2%. But after that, for the 2 years, there was a decrease in use because of the warning, and there was a concern that depression and suicidal thoughts was actually increasing. So what I want to emphasize is that we want to make sure we are addressing depression, and medications can be, in addition to other treatments and therapies, very, very effective, and wanting to make sure that people are not being afraid of using medications if needed.
Okay, and not to reiterate your lecture, but in children with anxiety, behavioral therapy was good, sertraline was good, but the combo had a 84% chance of some success. I think I remember that correctly?
Yes, so usually a combination of medications and therapy in some with anxiety and depression can be very, very effective, and that combination is higher than just therapy on its own or medications on its own.
Well, great. Once again, thank you so much for helping us. I think there was a lot of interest, a lot of questions afterwards, and I think we're all seeing a lot of kids that have anxiety these days, and you're helping us address that, so we appreciate you coming out.
Well, thank you very much.